Hello and welcome to the EduTalk Diabetes series hosted by EZ, Diabetes Dry Skin Therapy Lotion and Foot Cream, Biotone, and diabetes health and wellness experts. With the daily challenges of diabetes and interest in health and wellness strategies, the EduTalk Diabetes series supports building your wellness community by connecting you with diabetes health and wellness experts who share their knowledge and expertise on topics of concern to provide you the tools and resources for managing a healthier lifestyle. Today's expert is Dr. Dorothea Atkins, a holistic nurse, licensed massage therapist, educator, researcher, and facilitator of holistic self-help approaches to pain management, injury prevention, and wellness. Since 1999, Dorothea has been a member of the American Holistic Nurses Association and received her doctorate in theology from Holos University Graduate Seminary, where her focus was medical intuition. Her holistic private practice, Holos Touch, provides self-massage and self-care education for anyone with chronic pain issues. Let's listen and learn as Dorothea discusses self-massage, a new self-management approach for diabetes. According to the CDC, over 38 million people in the US have been diagnosed with diabetes, while countless millions remain undiagnosed with diabetes. Diabetes is a chronic disease, as you know, which among other health issues affects lower extremity complications, often resulting in ulcers, infection, gangrene, or amputation. Research supports how a regular routine of massage to feet and or hands provides pain relief, improved circulation, improved balance, improved mobility, plus benefits insulin absorption. Dorothea will share tips for creating a regular routine of self-massage to reduce and manage many of the debilitating effects of diabetes. Again, thank you everyone for joining us. Thank you, Dorothea. I would like again to remind everyone to please chat questions, which will be answered at the end of Dorothea's presentation. And with that, Dorothea, welcome. I'm turning it over to you, and I will see you on the other side.
Thank you. And okay, oops, here we go. Okay.
The green screen share button.
Oh, yes. Share. Oh, yes. Okay. All right. Thank you so much, Donnell, for that wonderful introduction. And I also want to thank Biotone for providing a platform for educators and for massage therapists to not only use wonderful get their wonderful supplies, but also to learn about other avenues that are available through the EduTalk series. And also, I would certainly like to thank the EZ products for being available for diabetic patients. Without further ado, I will begin. Again, this is on the new self-management, and I'm saying new because it is patient-driven, in that the patient will have an experience of learning what they can do for themselves for the various diabetic approaches with massage therapy. Today, we're going to talk about not so much about diabetes. Most of you are familiar with diabetes, and it was mentioned in the introduction. So we will focus mainly on the massage research and how you will be able to not only use it for yourself, but also discuss it with other healthcare professionals and some of your clients or patients. So we're going to cover these particular areas. As mentioned before, you had the information about diabetes, and there's type 1 and 2, and we all know there is no cure for this condition, and that the pancreas produces the insulin, and it is broken down into glucose. Most of us, most people I see are adult onset diabetes, people with adult onset diabetes. Again, we talked about the prevalence, and we focus on the self-care aspect of teaching patients what to do for themselves. The physical therapy, we say exercise, physical activity, and proper diet, which still remains a problem, and the numbers have continued to rise. So as far as the massage research, massage has been proven to benefit the decrease of side effects of chronic diabetes. There's a decrease in blood levels, decrease in hemoglobin A1C. It improves peripheral neuropathy pain, improves diabetic ulcer, and increases the blood supply. So how does massage benefit these particular areas? Well, basically, arteries, nerves, and veins run through muscles. What does massage do? What do we work on? Muscles. And if the muscles are tight and not released, they affect the circulation. Insulin is given subcutaneously, and light massage of just the subcutaneous tissue, which I'm going to demonstrate and have you experience as well, how that can prevent fibrotic buildup around the sites of diabetic injections. And it releases subcutaneous tissue. So these are the main areas that we see as massage therapists. And now what we're going to do is empower patients to help themselves by doing these techniques. There's always precaution. We say assess the skin. At least we get people to look at their bodies. So many times a person complains about their bodies, but they don't examine for themselves, or they can't even look and see their feet. So this will help them to pay more attention to their skin. The other precaution is assess the areas before and after massage. So you want to be cautious of any changes that they can observe. And to record the observations, again, let the healthcare provider know of any major changes, not so much as it relates to massage, because oftentimes they're not familiar with self-massage, and but just to keep their providers aware that they are doing this as well. And if they're on blood thinning medication, that has to be taken into consideration, and the patient needs to be aware of, to be mindful of that. Now we go into the many problems that affect the patients with chronic type 2 diabetes. If you tingling, numbness and tingling affects their feet turning blue, cracked toes, cracked skin, loss of feeling, the skin may turn yellow, loss of hair, fungus, and ingrown toenails. Now, with the self-massage technique that you're going to experience, at least they will begin to look more carefully at their feet. and the movements that you're going to be doing will allow them to enhance the circulation of the lower leg. The science is muscles move joints. So it's the muscles that we're releasing so to stimulate the circulation. And this is what you will experience next. Now, and looking at this picture, I do have also a picture of muscles. They have a tendency to go to the site of the feet, even foot massage, reflexology. But the information that is so consistent is these muscles of the lower leg move the foot. There are over 30 muscles in the feet. I see my statistically, there's over 100 muscles in the lower body, the thighs, and especially the calf muscles, the lower leg. So these muscles to make a big difference in not a big difference, but influence the movement of the feet. So I just want you, while you're sitting, just if you can reach your calf of your leg, move your feet up and down, back and forth. You'll feel the muscles moving. And then you make a circle with your foot, and you tilt your foot toward your big toe toward the floor, and then take it toward your pinky. You will feel all of these muscles moving. Now, massaging the feet will not release these muscles, but the movement of the foot will affect and relax these muscles and stimulate the circulation. And that will help the patient to be aware of the muscles that are back here, your calf muscles, your Achilles tendon, and all of those muscles that have to do with the foot. Okay. And also, I encourage people, my clients, when I teach classes, to do the alphabet in capital letters with their foot. And that will engage all of the muscles of the lower leg. They do those daily. I've seen, and I have felt, and they have felt a difference in their muscles of their lower leg and the toes. Okay, and looking at the strokes that you're going to be doing in a minute, I want again to reinforce that the layers that are involved in our circulation and muscles. We have the skin, of course, muscles. It's amazing how people don't talk about the muscles, but they'll talk about the joints. Muscles move every joint in the body. And as massage therapists and nurses, if that was in our many years ago, massage was part of nursing care. But we massage muscles, but we don't release them. And you're going to feel the difference between massaging the muscles and releasing them. And you can see that these muscles move these joints and the circulation that lies within the muscles. So this is very, very important. And when you move your foot up and down, that pumps blood down to the foot, and the venous system brings it back up. When a person is shuffling and not moving their foot up and down, well, then the fluid stays and muscles stay tight, and then that can become a problem. So the strokes that we're going to be doing is a tapping stroke, the glide stroke, and tension release. And again, you do not have to be a massage therapist to do these. Now, the self-tapping, so get ready. So you're going to make a soft fist, and you're going to just start here and tap 3 times in the area and going down to your hand. 1, 2, 3, 1, 2, 3. To the palm of your hand, come back up. We're going to do this twice. Come to under the armpit and go back down. And this is tapping. It is not punching. Okay, now with that, I want you to extend your arm out and close your eyes and feel what that feels like. your arm feel lighter? Can you feel the stimulation occurring in your arm? Now, on the opposite arm, I want you to rub. We're going to rub up and down your arm, and this too stimulates circulation. Rub up and down. And what I want you to do is feel that. Now, if you combine the tapping and the rubbing, you are increasing the circulation, because most people do nothing. I won't say, but very little. They may put lotion on, but that's not working the muscles that move the hand. There are 22 muscles of the forearm that move our hands. So we have to address these muscles in this way. Next, we have the abdominal release. Now, because a lot of people have enlarged abdomens, and for some reason, people don't think to massage their abdomen. Now, I'm of a certain age, and I'm massaging my abdomen, but massaging the abdomen does not release. This is the rectus abdominis muscle, and the subcutaneous tissue is above that. So what we're going to do is interlace your fingers and push right here, right underneath your pecs, your rib cage, and you're going to interlace your fingers and press your hand inward, and then you're going to push this muscle, your abdominal muscle, outward into the palm of your hand, and I'm going to count to 10. Now, push and pull, this is resisting. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, release. Now, what you will feel, it should feel a little lighter, and that's not all. If you take a deep breath, you'll find you're breathing easier. Now, we're going to do the same thing on the opposite side. You could do one side or the other. Press in and push out. 1, 2, I'm going to 10. 3, 4, 5, 6, 7, 8, 9, 10. Take a deep breath. I know you feel that release. And press in. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Feel the difference. And this is very empowering for people who have not touched their abdomen at all. Now, we're going to look at the injections. So the massage that we're going to be doing here will enhance the absorption, prevent fibrotic tissue buildup. Now, with this image that you see, the needle, some books say 45 degrees, and so I'm not concerned with the amount of degrees this picture it talks about. But you can see the needle is in the subcutaneous layer, and so it is not in the muscle layer. So this stroke that we're doing is just, if I put my hand here, you're just making circles after the injection. And 1, 2, 3, 4, 5, and you come back again and again. And what you're doing, the patient is doing, is disseminating the insulin so that the fibrosis or the fibrotic tissue does not accumulate. And after that, then they can twist and go back and forth, and that enhances the absorption. It does work. It does work, because again, when I see people with that, I ask why, they'll say no one told them to do that. So, and people sometimes are just afraid to touch their bodies. But once they have a nice sense of what good feels like, I find that they will do so quickly. Now, all of that said, we must talk about the position of sleep, because if we don't make people aware, nothing changes. Now, in this picture, it's kind of like a fetal position. You see how the head is laying on top of their hands. the arms are flexed. This is, you contract your muscles. And we're talking 8 hours of this. And people toss, that's why they toss and turn all night. And oftentimes people, this other consideration, they sit, if they're on the computer, they lean forward. One solution is to put a pillow, any kind of decorative pillow, under their, behind their back. So when they come back, the muscles will rest. So poor posture, sleeping contributes to chronic pain. And if they have a large enlarged abdomen, if they put a small pillow or take a towel and put it underneath the sideline position, right underneath the abdomen here, it takes the pull away from the lower back. Okay, now next, this wedge pillow. It looks like a slice of cake, and we have pillows on top. This pillow is so important if a person, especially if they're overweight and they can't breathe. This will assist in breathing. It really does assist in breathing. And then you put their regular pillow on top. Immediately, they feel the difference. They breathe easier. So the wedge pillow supports the breathing, and it also supports their body. And now giving you some where to, the other positions. When you lay on your side, put a firm, it must be a firm pillow between your legs. The soft pillows, it's hard to find a firm pillow. You have to go around and squeeze them. It must be lengthwise, not that pillow that they have just between your legs. But I'm sorry, between your knees, because the lower leg hangs down some, and it also adds pressure to the knees. If the knee and the hip are in alignment and the ankle in alignment, and that enhances circulation, and they will turn naturally, but they won't toss and turn. Now, when you lay down on your back, again, if they have a pillow under their head and a wedge pillow, if they don't have a wedge pillow, I've taught people to use their travel pillow, put it this way on top of their pillow to support their neck. But arms, the pillows under the arms will support the shoulder, elbow, and hand immediately. And then there should be a pillow under their knees, and a firm pillow, and that will relax the lower back, guaranteed. We as massage therapists put a bolster under their knees, but we don't tell them why the bolster is important. In my office, I have all of these pillows so that they experience it before they leave. If they're a senior, I contact their family to let them know, but when their birthday, Christmas, this is what you get them, okay? Now, this is, in summary, self-massage may prevent the complications. And in preventing the complication, that won't cost them money. It's self-care. They can't hurt themselves. It can be done anytime and anywhere. But this is not in lieu of complementary alternative therapies, yoga, Tai Chi, you're going to physical therapy, exercise, walking. What this does, it frees the muscles up so they can do so better, effectively, versus shuffling along. Because sometimes they tell them to walk and they're shuffling. They're not really using their heels, sole, and toes properly. Self-massage and exercises will improve circulation. So you do the self-massage first, and then you exercise, or then you do yoga. You do the abdominal massage after your insulin injection, the leg and foot and toes. So if you open and close have them open and close their toes, wiggle their toes, that will enhance the circulation to their feet, and that will help them avoid fungus and many of those side effects that they have. Pillows will improve their sleep and relax muscles. Okay, in review, you had the I'm going full speed ahead here. In review, you've had the foot exercises, and these are just suggestions. I'm saying to you, think outside the box. And they can reach their toes. Sometimes people say, I can't reach them. Well, then cross your legs, show them that they can. Going and having it done, or soaking your feet, or doing a foot massager, or of a vibration, it does not release the muscles. So they just, this is what happens. And the muscles are not released. So, and therefore they feel good, but when they when they start walking, it's the same posture and the same feeling. They feel the same way. The abdominal release, again, light circulation, and again, it has to be people need to be informed about the importance of pillow support, and go and its contribution to self-care. Okay, again, this is not a replacement therapy. Again, as a massage therapist, I figured this out. And that's where the next class that I'm teaching next month, this is a little commercial. I funded my own research for self massage, because I saw when my clients left me and felt good, but always came back with the same problems. I visited their homes and I could see what the problems were. I sat in the couch and couldn't get out of the chair, all these kind of things. But this has, in these past, this my research was published in 2015, so I've been at this a long time. And just another FYI, I did present at the Massage Therapy National Convention last year, and I'm going to submit another proposal this year. And I also presented at the National Holistic Nurses Association, so that they can begin to educate patients so that they are empowered to do these things to help themselves. And again, these are some reference points. And all right, that's the end. Woo, half hour. All right, so I'm going to stop sharing. Let me see how this is. All right, so share. Oh, stop sharing. All right.
Oh, that was like a marathon.
It was.
Great information shared. I'd like to invite our audience to ask questions. And Dorothea, we have time for Dorothea to answer them.
Yes.
Now, I know, and probably because you're sitting at the desk and the screen is only so big, when you did the tapping and
Yes.
the rubbing on the arm,
Yes.
that would also be applicable to the feet.
Yes.
Like you would tap on your feet.
Yes, right. Yes.
Aside from the feet, are you tapping all the way up the leg?
Yes, that's when I do the self massage. It's a stronger tapping, because those muscles are stronger and bigger. So here you need it more close to the surface of the skin, but the glutes and the quads and the hams and the lower leg, we could go to town with those.
Funny. I don't know if I had any other questions. Like the pillows, let's talk about that, because I know the massage industry,
Yeah.
as you mentioned, has bolsters and pillows, etc. Is that what you would recommend people do, as opposed to just going to Target and finding something?
Okay. No, I find that the bolsters are too hard for a person to sleep on. So getting a firm pillow will automatically, it relaxes the psoas muscle. It's immediate. And then they'll say, oh, that feels so much better. It's immediate. But the bolster is too, because the person is only on the table for an hour, and then we put it under the ankle. But a firm pillow. Some people put 2 pillows in one pillowcase, and that would help as well.
Okay. I just had a thought about going back to the legs and the tapping.
Yes.
It doesn't matter. Do you start at the feet and tap up, or
No, we go down. Because yes, so because the feet cannot move if the muscles above it are tight. That's why when a person is shuffling along and we massage their feet, it does not, the benefits don't last, because the muscles are not engaged. These muscles move the joint below it.
Okay, so you're freeing up the larger muscles
Yes,
and working your way down.
yes.
All right. And Anna had a question. Do you offer any self-massage CEUs for massage therapists to train the trainer so we can train our massage clients?
Yes, I do. I do have them, and through train to trainer. However, I have to figure out a way because right now they have me to come do CEUs in person because I like to make sure that that is done correctly. Trainer does not. You can look, but a person, unless they feel it and then educate, I just found that in person was just so much better. So if I can figure out a way, but I do have CEUs with that, and I think it's 8 hours. Yeah.
Okay. And I'd like to mention to everyone that tomorrow you'll receive a follow-up email, which will include the recording link, Dorothea's handouts, and also her contact information so that you can contact her directly. Dorothea, I wanted to ask you, when we were on Zoom the other day, you mentioned the University of Florida was in
Oh yeah.
contact
Yeah.
with you for research.
Yes.
And that would be regarding,
Oh,
uh,
yes, they are expanding my research so that they, again, because mine was a little research, and when it comes from a university, they have a bigger budget, and that I'm working with them, I'm consulting with them to that. So the key is to empower people to stop the disparities of for people who cannot get to the doctor. And we know our healthcare system has changed. You got 15 minutes, and the people don't know how to explain what's happening to them in 15 minutes. So that's what I'm saying. So this self-education, it requires a nice shift from the conventional way of doing, telling somebody to exercise and go for a walk or physical therapy without doing this self-care work I had.
well, very good. I just chatted out that there's still time for a few
Oh,
questions.
yes, yes,
And meanwhile, now that you've caught your breath,
yes,
were there any other
yeah,
additions to your PowerPoint? Did you rush through anything you wanted
yes,
to cover
yes.
again?
All right. Especially the feet. Um, we forget to massage. This is what the foot looks like. All right. We forget the individual toes are linked all the way up the lower leg. And so when you open your toes, don't just move it. Hold the position for 5 seconds and then come back and hold it. Then the body knows, oh, we're getting a signal. It's safe to let go. If you just move them, just move your feet, it won't let go. So giving that signal, and then you can use a ball, not a hard ball, to roll it around on the bottom of your foot so that you can stimulate your sole of your foot and the arch of your foot. And that way, again, you give this signal of increasing the blood flow to your feet and open and closing it up. And then and that way a person will look at their feet and have a nice sense, oh, I have an opening here, and address it with the easy care cream. I didn't know it existed, but there, quality cream that moisturizes your feet, because that's the furthest from your body. So these are the types of things that we begin to, because I think outside the box, to help themselves, because some people use Vaseline, can you imagine, because they don't know. And you don't have to be a big time healthcare provider to do this. Is self-care, and they leave there empowered.
Right. And self-care is so important because I think it's something we take for granted.
Yes.
Um, we have a question. What is the Easy Care Cream? Easy is a therapeutic dry skin
Mm,
lotion for diabetics
yes.
that is a sister product to Biotone. And you can learn more about it. I will include links in the follow-up email tomorrow. You can either Google ease-z, or the website is ease-zinc.com. And you can learn more about the diabetes dry skin therapy lotion or foot cream there. And the website was just posted in chats. So again, I'll include that in tomorrow's follow-up. And thank you for mentioning that. There is more, here's a website for more information. So you can learn more about the easy
Yes.
products and the importance of zinc in treating the dry skin. So I don't see any other questions coming in, and thank you for, Anna, thank you for your questions and your interest. Thank you everyone for joining us tonight. Again, watch your inbox tomorrow and join us in February when we have, February 13th, we'll have Wendy White presenting on massage considerations for clients and patients with diabetes. So thank you so much for joining us. On the Easy website, the eZinc website, there is also an archived library of previous EduTalk Diabetes series recordings on different topics. So thank you so much for being a part of this tonight. And thank you, Tricia. And join us again.
Yes.
And feel free to email any topics that you would like to see us cover in regards to diabetes. Appreciate it. Thank you so much. Be well, everyone.
Bye. Bye, everybody.
Bye.
Bye-bye.